Hey everyone, thanks for listening to our presentation on Sister Calistia Roy and Jean Watson. We're going to walk through the basics of each theorist, how their ideas show up in real nursing practice, and the pros and cons of using their theories today. We kept things simple and relatable, so by the end you'll have a clear picture of how Roy and Watson compare. Our group is a mix of nurses from very different backgrounds, which made this project fun because we all saw these theories through different lenses. Brandon works in the surgical ICU and is also a critical care paramedic. Stacy is in the ER. Lori is on a med-surg floor. I am on the trauma unit. And Rebecca works in adolescent mental health and med-surg. Having such a variety helped us talk through how these theories apply across different patient populations. Sister Callista Roy was born in 1939 in Los Angeles and originally worked as a staff nurse before beginning to teach. While she was working with nursing students in the late 1960s, she started noticing patterns in how patients responded to change in their health. That's what sparked her whole idea of adaptation. Over the years, she became a major influence in nursing theory, published numerous articles, and even founded the Roy Adaptation Association. She has a pretty impressive educational background, degrees in nursing, pediatric nursing, sociology, and even a postdoc in neuroscience nursing. A lot of her theories come from her sociology training, which is why she talks so much about people being biophysiosocial and how the environment plays a huge role in how patients respond. Jean Watson was born in 1940 in West Virginia. She originally wanted to study literature, but after her father passed away when she was a teenager, she shifted into nursing because she was drawn to the human side of healing. She worked in psychiatric and mental health nursing, which really shaped how she viewed caring, connection, and emotional presence. Eventually, she developed what we now know as the theory of human caring. She earned degrees in nursing, psychiatric mental health nursing, and educational psychology. Later on, she became dean of the University of Colorado School of Nursing and held the first ever endowed chair in caring service or caring science. Over time, her work expanded into what she calls caring science, which focuses on mind-body-spirit connection and how nurses can create environments that promote deeper healing. Roy sees people as constantly interacting with the environment and consistently trying to adapt. In her theory, health is how well a person copes and stays balanced. Illness is when that balance gets thrown off. So the nurse's job is to identify what's causing the stress or change for the patient. Roy calls these stimuli, then support them in adapting in healthy ways. She breaks stimuli into 3 different types. Focal, which is the main thing happening right now. Contextual, which is everything else surrounding the issue. And residual, which includes unknown or unclear factors. She also talks about 2 different coping systems, the regulator system, which is the body's automatic responses, and the cognator system, which is more mental and emotional. These help guide how nurses assess what's impacting the patient and how to support them. From there, Roy divides adaptation into 4 modes: physiological, which is the physical body stuff, self-concept, which includes identity, emotions, and spirituality, role function, or how someone functions in their expected roles, interdependence, which is about relationships and support systems. Nurses review each of these modes to identify where a patient might need help adjusting. On the other hand, Watson focuses much more on the emotional and spiritual side of nursing. She sees humans as whole beings, mind, body, and spirit, and believes that caring is the foundation of healing instead of zeroing in on stimuli and adaptation, as Roy does. Watson emphasizes presence, intentionality, and building a meaningful connection with the patient. Some of the big ideas in her theory include transpersonal caring relationship, a deeper connection between nurse and patient, In the caring moment, which is when the nurse and the patient share a meaningful interaction, she created the NUR3846 process, which serves as guidelines for how to bring compassion and presence into practice. These 10 processes include practices such as practicing loving kindness, supporting patients' faith and hope, using creative problem solving, allowing patients to express their feelings, and creating a healing environment. They encourage nurses to look beyond the tasks and routines of a normal day-to-day and approach care with intention and empathy. Roy's theory of adaptation remains relevant in modern nursing, focusing on the 4 adaptive modes: physiologic, self-concept, role function, and interdependence. This slide will focus primarily on how the psychologic, self-concept, and interdependence modes remain relevant, with an example of how they pertain to nursing care. In practice, Roy's theory helps nurses identify where a patient is struggling to adapt. For example, if a patient is complaining of pain, the nurse assesses the psychological state and considers interventions that might help, such as repositioning, distraction, or pain meds. The goal is always to help the patient restore balance so they can adapt more easily. In the self-concept mode, the nurse might help a patient adjust to something that impacts their sense of identity. A good example is someone facing an amputation. The nurse supports them emotionally, gives clear education, prepares them for what to expect, and basically walks with them through the process of accepting such a significant change. In pediatrics, the interdependence mode is huge. Kids rely heavily on their parents or caregivers, so including them in the plan of care helps the child feel safer and more supported. Nurses use this mode to strengthen the patient's connections, which helps with overall adaptation. According to Watson's theory, caring moments often come from slowing down and being present. For example, when a patient gets anxious before a procedure, the nurse sits at eye level, uses a calm voice, explains what's going on, and just connects with them. That small moment can totally shift the patient's emotional state and build trust. Another example is caring for a patient who can't move or bathe independently. The nurse gives a warm bath, changes linens, reduces noise, and explains what they're doing step by step. These actions help the patient feel human again, not just like a body in a bed. That's a big part of Watson's focus, which is protecting dignity. And when a patient opens up about being scared before surgery, the nurse listens, validates her feelings, and helps them use coping strategies. Maybe they encourage prayer if that's meaningful, or teach grounding breathing techniques. The nurse combines emotional support with clinical reassurance, which is exactly what Watson talks about. Both theories are valuable, but each has limitations, especially in fast-paced settings. Roy's model can feel complex and time-consuming because it relies heavily on the nurse's subjective interpretation of stimuli and doesn't offer clear, measurable steps for how to change them. It tends to work better in long-term care or research settings where there's time to observe patterns and responses. While it could be used for quick goals like removing a stimulus to lower a heart rate, it's not always practical for busy units like the ER or ICU. Watson's theory also has challenges. It's rooted in spirituality and physiology, which doesn't resonate with everyone and can be hard to apply when time is limited. The theory is abstract, lacks specific practice guidelines, and depends heavily on the nurse's own desire for personal or spiritual growth. While evidence supporting her theory is growing, empirical research is limited. Overall, knowing these limitations helps nurses take the parts that fit their practice without forcing what doesn't. In the end, Roy and Watson both bring something important to nursing. Roy helps us understand how patients adapt physically, mentally, and socially. Watson reminds us to lead with compassion, presence, and humanity. Even though they take different approaches, both theories help us care for patients in meaningful and holistic ways. Thank you so much for listening.